My name is Donald. I'm going to be the nurse practitioner taking care of you today. But before I proceed, we're going to be doing head to neck exam, which is going to comprise your head, your eyes, your nose, the mouth and your throat, and also your neck. But before I proceed, I know I'm your dad, but it's very important that I obtain a consent from you and make sure I have a permission before I can shoot this video, because this video is going to be posted to YouTube. This will enable my instructor and my professor to see what I'm doing with you and all that. I would just want to know if it's okay for me to do this with you. Yeah. Okay, thank you. So we're going to start off right away by doing the starting from your neck. Like I said, I'm going to do head to neck exam. So I'm going to be starting from your head. So what I'm going to be doing is inspect your head, making sure, looking at the hair distribution. I'm looking at, so I'm just inspecting, making sure there's no bump or lumps. Looking at the shape of your skull, making sure, and looking at the back of your neck, the hospital. And also I'm going to be palpating, I'm going to be touching, looking for any contour, and also making sure there's no depression, and there's no bump, lump anywhere. Okay, so that's good. So also I'm going to be looking down on the, so like I said, already get that. So I'm going to be looking at the face. I'm looking for symmetry, making sure everything is the same on either side. While I'm looking at that, I'm looking at any scarring on your face. Is there any wound, any lesion on your face? I'm looking also for any involuntary facial movements. So while I'm looking at that, I'm also going to be looking at your temporal, down your temporal lobe. So I'm feeling your temporal pulse, feeling the artery right here. Okay, so I move down to the mandibular joint right here. So I'm gonna have you open your mouth for me and close it. Okay, good. So when I'm done with this, I'm still pretty much on your face. I'm looking at your sinuses right now. So I'm looking at your frontal sinuses and maxillary. So I'm gonna start from the frontal sinuses. I'm coming down to the maxillary sinuses. I'm looking at, checking for pressure. There's any pain? Do you feel any pain here? No. There's any tenderness? No. So with that, okay, that's good. So I'm going to be looking at your eye. I'm inspecting your eye. I'm looking at the internal structure. I'm going to be looking at your sclera, which is the white part, making sure it's nice and white. I'm looking at the other one, it's nice and white. So I'm going to pull down your lower eyelid, looking at the conjunctiva. Can you look at the conjunctiva? Make sure it's not pale, it's nice and pink. That's good. Yeah. So I'm also trying to see if there's any foreign bodies and things like that. I'm looking at your eyelashes, like I said, the crusting of your eyelashes, the eyebrow, and things like that also. So what I'm going to be doing also is, since I'm also examining your eye, I'm going to be looking at, I'm going to bring my otoscope. Are you sleeping on me, boy? We're going to be looking at your otoscope. I know you're tired. You went to school and you came back, you went to play football and all that. So don't sleep on me. So I'm going to be, I have my otoscope with me. I'm going to be shining light on your eye. So I'm trying to see any pupillary reaction and things like that. Making sure there's direct. So I'm going to be doing this, making sure there's a pupillary reaction. Yeah, there is direct and consensual constriction, making sure both your pupils, they are equally round and reactive to light, and they are to accommodation also. So that's why I use that to check there. And also, since I'm under the eye examination, I'm gonna be checking your visual field, your peripheral vision, making sure. So I'm gonna ask you to tell me when you can see my fingers. Can you see my fingers? Yeah. Okay. So I'm gonna switch to the superior posterior view. Can you see? Yeah. Okay. So this is more like a confrontation testing. So I'm also going to be doing the cardinal view of gaze. So that way you're gonna be following my finger. Arnold, you sleeping on me? You're gonna be following my finger. I'm doing the 6 cardinal view of gaze. So just watch, right? So I'll go lateral, up, down, back to midline, back to the middle, across your view, up, down, back to the midline, back to the middle. So I want to see the convergence. That way I want to see, I'm going to bring my finger closer to the bridge of your nose. So I want to see, I want you to look far at the distance. So that's the convergence. So that's a good thing. So now, since I'm also examining your eye, I'm going to bring my ophthalmoscope before I proceed to the next one. So yeah. So to complete the eye exam, I'm going to do the ophthalmoscope. So I'm looking with the left eye, my left eye to your left eye. So I'm trying to look for the red reflex. So I'm trying to look at the structure behind your eye. I'm looking for the nerve disc and also optic disc and optic nerve, making sure. And also looking for the macular. Okay, so looking at the blood vessel and all that. Gonna do on the other side. Wow. Okay. Good. So that concludes our eye exam. So the next thing we're gonna be doing, okay, after the eye exam, I'm gonna be doing your hair. So basically I'm gonna be looking at the external structure of your hair, and I'm looking at if there's the outside external canal of your hair. I'm looking at the formation and placement of your hair. I'm looking at the external canal, making sure there's no drainage, there's no discharge and things like that. I'm looking at this, and I'm also looking at the other side the same way, making sure the placement of your hair, and I'm looking at the external canal, making there's no discharge and there is no discharge, there's no drainage. And also the next thing I'm going to be doing is I'm going to be doing your whisper test. Okay, whisper test is I'm going to have you occlude one side of your hair, and I'm going to whisper to this side, and whatever you hear, you're going to tell me. Okay, one more side. Baseball. Okay, you want to do this side? I'm going to occlude one side of the hair, the same. Occlude again. Okay, so that concludes our whisper test. The next thing I'm going to be doing for the hearing, I'm going to also do the talk test. So this is more for me to pull the pinner of the auricle of your hair. So I'm going to pull up, pull back and down, and I'm going to do the same, pull up, back and down. So if there's any pain, that way kind of, which would suggest that there's something in the internal canal of your ear. So with that, by me tugging and pulling back, and if you didn't make any noise about pain, or you didn't feel any, experience any pain, it shows that it's okay. So that's why it's good to do the tug test first. All right, before I can even insert the speculum. The other thing, so what I'm gonna do right now is to look at, I'm gonna bring my otoscope out, and I'm gonna be inspecting the inside, the internal canal of your ear. And I have the speculum here. All right. Okay, I have that. This is the largest speculum that I have here. Okay, I'm gonna put this right here. So I'm gonna pull up and back. I'm trying to look at the internal canal of your ear. So what I'm looking for, I'm looking at the tympanic membrane. I want to make sure what I'm looking for redness, but it should not be red. If there's any redness, it indicates infection. So what I'm looking at right now is like a paley white. So it's not red. That's good. I'm gonna look at the other one side. So gonna come on this side. It's gonna do the same. Pull that and all that. It's looking at the same, making sure. So that's good. It's not red. It's peely white, so that's good. So the other thing I'm going to be doing for your hearing is to check for any hearing loss. But before I can do that, I'm going to do which is called a Weber test. Okay, I'm going to have my tuning fork. So I'm going to strike my tuning fork right here. Hello, Arnold, you sleeping? Arnold, are you sleeping on me? So let me know if you hear the sound. You should hear the sound equally on both here. Can you hear them? Can you hear the sound? Are you hearing longer? Are you hearing better on one side of the ear than the other? No. Okay, so equally. So that's good. So I'm gonna do, that's called Weber test. The other thing I'm gonna do is called Raining test. So this is, so it means that the one we just did now, there is no conductive hearing loss because you can hear, because we check the lateralization. So the other one I'm going to do right now is called Raining test. So I'm going to do it again. So I'm going to put this at the back of your ear with the mastoid process. So let me hear, when you can no longer hear the sound, let me know. Tell me.
I'm pretty sure it's stopped.
Okay. So I'm going to do, when you can no longer hear the sound, let me know, okay? When you can no longer hear, let me know. Are you still hearing it? When you can't hear it, let me know. You still hearing it? When you can no longer hear, let me know. Okay, how about now? Are you hearing it? Can you hear it? Okay, so that's good. So that means your ear conduction is greater than your bone conduction. So when you stop hearing from the back, that's your bone. So when I put it back, I put it in front of your ear and you can hear it. You can still hear the vibration. So that means your ear conduction is greater than your bone conduction. So that's good. So that kind of concludes our hearing exam and your ear assessment. So the next thing I'm going to be doing right now is to check your nose. And I'm going to have you tilt your head for me. So I'm looking at your nose. This is my otoscope. I'm looking at making sure there is no deformity, okay? And so I'm going to be looking at your, I need to have my speculum. Are you sitting on it? Okay. So I'm going to have my speculum. So I'm looking at the nostril and the nares. I'm gonna put my this way. I'm looking at the nostril and nares. Look, I know it tickles. So making sure I'm looking at the turbinates. While I'm still inspecting, make sure your mucosa, it's not red, but it's kind of pink. It's less red than the throat of your mucosa of your throat. So I'm looking at the septum, making sure it's not deviated on one side or the other. So I'm gonna do on this side too. Okay, so that's good. Making sure there is no discharge or drainage. It's clear, there's no discharge. So that's good. All right, so that's kind of, for the ear, it's kind of that way. So the next thing we're gonna move into, so I did your here, I did your here. So I'm gonna be moving down to your mouth. So if you can, those, inspecting your mouth, the external mouth, your lips, I'm looking for any crusting, any cracking, if there's any wound or like a lesion on your mouth and things like that. So that's what I'm looking for. But the next thing I'm going to have you do for me, so that it's nothing like that, there's no cracking, there's no lesion, I'm going to have you open your mouth for me and say ha. So I'm looking at right now. Stick out your tongue for me. Stick out your tongue. So I pretend like I'm doing the tongue depressor. Open your mouth for me so I can see. Stick out your tongue. Stick out your tongue. So I look at the uvula, it's midline. Open, stick out your tongue for me. Okay. Tonsil. Okay. There's no redness at the oropharynx. Okay, you can bring that. Lift up your tongue for me. Try to look at the submandibular and sublingual joints. So that's good. Normally I'm supposed to have glove in my hand to look at the dentition of your mouth and to check, feel that point. But unfortunately, I don't have the glove in my hand. So good. So that I look at the soft palate and things like that. That's good. All right. So the next thing I'm going to be doing is your neck. Okay. To check your neck. All right. So I'm going to be looking at making sure there's I'm looking at the trachea. I'm looking at its midline. There's no. I'm looking at the trachea alignment, making sure it's midline and all that. Okay, so it's good. And when I'm looking at your neck, I'm going to be looking at the lymph node. Okay, so the first lymph node I'm going to be looking at is going to be from the preauricle, that is before your ear, and I'm looking at it to look for with the part of my fingers, 3 fingers, in a circular motion. I'm looking at that. So the next one is going to be post-auricle, which is the back of your ear. There's any lymph node? Okay, no. So I'm looking, the next one is going to be tonsillar. This side, lymph node? No. Okay. The next one is going to be mandibular, submandibular, right here, and also submentor, which is below your chin right here. So nothing. Okay. All right. The next one I'm going to be looking at is going to be anterior anterior cervical, like right here, on both sides, like right here. And also I'm going to be looking at the posterior cervical. That is around where your sternocleidomastoid is. So I'm going to have you look at the opposite. You're going to look at your right this way, like right here, the deep, to check it. Okay. So the next one I'm going to be checking is going to be your supraclavicle, like right here. I'm looking at I'm looking for the lymph node. And the next one is going to be infraclavicle, like right here below the clavicle, right here. There's nothing. Okay. So the last one that I'm going to be checking for is going to be to check your thyroid and lymph node. Okay. And the best way you can check it, two different ways. You can check it anteriorly, and you can also check it posteriorly. Since I'm in front of you, I'm going to do the anterior way of checking it, which is going to be to check from side to side. So this is where your thyroid is supposed to be. So to check for it, I'm going to palpate on the side, on each side. So I'm looking at right here, looking for any nodule, looking for any lumps, okay, and any bumps right here on the side. So to check it posteriorly, I'm going to come from your behind right here, and I'm going to feel from the cricoid cartilage right here, cricoid cartilage below a little bit right here, and I'm going to have you pretend like you are swallowing something for me. Can you pretend like you're swallowing something for me, Arnold? Okay, good. So I'm going to move down a little bit and up. So I'm palpating right here at your thyroid. I'm trying to feel if there's any numb, any nodule. So most of the time, and the other time I'm going to check behind the hospital, behind your neck, looking for any nodule also. So most of the time, if there's any lymph node, they are non-tender, they are mobile, and but if they are, sometimes they could be tender and they could be fixed and hard, but that should be worrisome because that means there's going to be a workup to be needed. So with this, it kind of concludes our head to neck exam. Thank you, and thank you for sleeping on me, boy. Thank you for sleeping on me. All right, that concludes our, yeah.